Hello friends and welcome back to my channel. In this video we are going to talk about tuberculosis, liver pathologies, pleural effusion, under which the categories will be transudate effusion and exudate effusion, hematological values, only the values which are important for you to remember. No need to remember about all of the hematological values. Alright, so let's start. So tuberculosis is a bacterial infection caused by Mycobacterium tuberculosis, which will primarily affect the lungs but can spread to the other parts as well. What we are going to see is latent TB infection and active TB infection. Sir, what is latent one? Sir, we have seen in the syphilis also there is a syphilis latent stage of syphilis as well, in which there will be no clinical symptoms will be there, but the patient is still having the bacteria somewhere inside the body. So the latent TB infection is also the same, bacteria present in the body but inactive state, no symptoms are there, can become active if immune got weak. The immune system if got weak will the bacteria will get a chance to divide more and get a chance to show the symptom. For example, in cases of HIV, we see the immune compromised state of the patient. Symptoms what we are going to see is persistent cough which will be lasting more than 3 weeks in the patient, coughing up blood or sputum. Guys, remember that coughing up blood was in the cases of cancer, and now we are seeing it in the cases of tuberculosis. So when we are asking about coughing up blood, this is something not micro, this is a bit macro. In the cases of like pneumonia or any another thing, if we see that blood is there in the sputum, so that will be in very minute amounts. But sir, here in the cases of cancer or tuberculosis, we are going to see more coughed up blood in comparison to the other pathologies. So you can see the respiratory symptoms, chest pain, weight loss can be there or cannot be there. We will hear it from the patient if they are experiencing the weight loss. Night sweats, not very typical. Fever, chills. Symptoms, I hope you will remember the symptoms, but let's say the symptoms will be related to the part of the body where the bacteria has traveled, and most of the time tuberculosis is related to the upper lobe of the lungs. The bacteria love the upper lobe of the lung, so it's very tasty for him. So the upper lobe of lung, the bacteria will be having as a dinner, breakfast and lunch. Extra pulmonary TB, this is something back pain in the spine or blood in the urine. So like if the bacteria travel to the spine, we will see back pain in patient. If the bacteria travel to the kidney, we will see the nephro version of the tuberculosis, so blood in kidney. Let's see some patients. So this is something to remember for you. Before the patients, you have to remember this one. So 6-month-old baby, not vaccinated, no health complaint, temperature is there, respiration, BP. Tactics must the doctor choose according to the regulatory docs. Child's height and weight gain are within the ranges between 50th and 75 percentile. Sir, the 6th-month baby, first of all, is not vaccinated. He is not complaining about the health as well. No health complaints are there. So temperature is there, respiration is okay, BP is low. Or maybe respiration is a bit not in the norms. What tactics the doctor should do? Sir, when you as in the cases of cancer we discussed, when the question doesn't make enough sense to you, go with cancer. So in this case also, maybe the cancer, I don't think that option was there in the cancer option was there in this question as well. What you are going to do is you are going to perform a Montux test, because the patient is having no health complaints, only temperature is there. More significantly, only the temperature is there. So perform a Montux test and make an appointment in 2 days. So you have to remember, friends, that this is something, this question is, you have to remember it, that perform the Montux test in that 6-month-old baby who is not vaccinated. So when the baby is not vaccinated well, so we can suspect about the bacterial infection, that tuberculosis bacteria. So vaccination against tuberculosis is very important. So when the 6-month-old baby is not vaccinated, so perform the Montux test, which is for tuberculosis, and make the appointment in 2 days. So let's see what our adult patients are complaining. So our first patient is a elderly patient. He is complaining. He is a heavy drinker and smoker, constant coughing, losing weight. So yeah, in tuberculosis bacteria, the patient do complain about losing weight. So unlike other pathologies, so similar to cancer, the patient is complaining about the losing weight. So you have to remember from the portion of the introduction. So objectively, cervical nodes are enlarged, dense tissues above them exhibit no tensions. X-ray shows fibrosis of the upper pulmonary lobe. Sir, we remember from the introduction part that the tuberculosis bacteria loves to eat the upper lobe of the pulmonary lobe in the breakfast, lunch and dinner. All right, so positive left-sided pleurisy and pleural fluid, straw colored protein, this much lymphocyte count. So pleural fluid is there. So this is also the case of exudative pericarditis. So I'll let you know in the next portion. The main thing to remember from this question is, what is this, sir? That fibrosis of the upper pulmonary lobe is typical for tuberculosis. So next patient says what? Next patient says about the 30-year-old woman complains of subfebrile body temperatures, persist for last 3 weeks, loss of appetite, working ability, excessive sweat at night. So yeah, the patient does complain about this, all of them. The patient is complaining about the cough is there, coughing up blood. Blood we haven't seen yet, but let's see. Chest pain, unexpected weight loss. So yeah guys, same like cancer, the tuberculosis patient is also complaining about the unexplained weight loss, night sweats and fever, chills, all of them. So let's hear more to the patient. Excessive sweating at night or malaise, which is myalgia or muscle pain. So percussion detect no changes. Auscultation says crackles in the upper lobe of the right lung. So they are saying something about the upper lobe. So let's see the X-ray. How we the first thing to diagnose anything with the lungs, we are going to do with the X-ray. So a dense focus of moderate intensity. So there is a dense focus in the segment S2. Sir, where is S2 segment? Sir, S2 segment is most probably the near to the upper lobe of the lungs. All right, so when the question is saying dense focus, so you are going with the focal pulmonary tuberculosis. Some things to remember guys, we cannot make logic out of everything because we are going with the fast revision session. So remember about when the dense focus of moderate intensity in the S2 segment is there. So this is the case of pulmonary tuberculosis focal version and affecting the S2 segment, which is upper pulmonary lobe. All right. Next patient says what? General weakness, low grade fever, 4 months, anamnesis as frequent acute respiratory disease, overexposure to cold, lower calorie diet, case of pulmonary tuberculosis in childhood. This is better for you and me that the question has already provided the history of the pulmonary tuberculosis. So next is urinary changes are there, CBC changes are there. This is more important to us, the highlighted part. Foci of calcification in the projection of the right kidney parenchyma. Sir, history is given in the question about tuberculosis. Now the problem got with the foci of calcification in the projection of the right kidney. So sir, this is the case of nephrotuberculosis, that after the lung tuberculosis the bacteria has traveled to the nephrosystem, and the urography shows dilation of renal pelvis calyceal system in both of the kidneys. So dilation is caused by which one? Dilation is caused by bacteria tuberculosis. Next patient says what? Dry cough, hemoptysis. So hemoptysis, we got it here. Shortness of breath during physical examination, general weakness, excessive breathing. Auscultation says bronchovascular breathing, fine wet crackles in the area after coughing. And in percussion detect dullness between the shoulder blades on the right. So shoulder blades are where? In the upper, near the upper pulmonary lobe. and X-ray shows 2.5 centimeter ring-shaped lucency in the second rib. Sir, are you going to mark abscess after seeing the ring-shaped lucency? Sir, no, abscess is not very common. However, abscess can occur in any portion of the lungs. But sir, remember that second segment or second rib is related to the upper lobe of the lungs, and upper lobe is affected by, this is the favorite dinner for tuberculosis bacteria. So sir, when you see a ring shaped lucency in the question, please do not mark abscess. My friend has been marking abscess a lot of time, but let's highlight it again and again that tuberculosis affects the upper pulmonary lobes. So, and here it is given that dullness between the shoulder blades on the right, X-ray finding, as X-ray says what, 2.5 centimeter ring shaped lucency in the rib 2. Sir, rib 2 or segment S2, both of the things are related to the upper pulmonary lobe. I hope this is clear now. If you see more questions over tuberculosis, just write me in the comments. I was able to detect only these questions or scan only these questions from my notes. If you find new questions, then feel free to comment them in the comment box in order to help you, me, and all of our friends. So let's read the symptoms one more time so that we can remember it. That in the cases of pulmonary TB, the patient complains about persistent cough is there. He can have hemoptysis, chest pain, unexplained weight loss, night sweats, fever, chills, fatigue, weakness. So the symptoms are really related to cancer as well. So just think how dangerous is tuberculosis bacteria for us. And now you know that why did we decided to vaccinate this 6-month-old baby, or why did we perform the Montux test in this baby? Because sir, even if we suspect tuberculosis, we know that it's gonna be very dangerous for our pulmonary system and other system as well. If the problem is confined till the pulmonary system, we can detect it as any time on the X-ray. But sir, latent TB infection can be there. The bacteria may travel to other parts of the body, and maybe the patient doesn't remember or doesn't tell you in the anamnesis that he had tuberculosis before. So remember about this. Next is about the liver. Before heading to the question for the liver pathology, let's see what is hepatic encephalopathy. So hepatic encephalopathy is the brain dysfunction which is caused by the liver failure. So what is liver failure? So liver failure is loss of the function of the liver. What main function of the liver which you have to remember is liver detoxifies the ammonia, toxins, and blood toxins and drugs from the patient. The liver also helps you with the blood clotting, and it releases some factors like prothrombin. So when hepatic failure is there, simply means the loss of liver function is there. A lot of symptoms which you will see in the patient in the cases of liver failure, but remember that two main function of detoxification and blood clotting factors. So hepatic encephalopathy is brain dysfunction due to liver failure. So what we are going to see in the patient, altered mental status due to impaired detoxification of pneumonia. What happens is the liver fails to detoxify ammonia from the body of the patient, and now this ammonia will get deposited in a lot of parts of the body. More prone to it is brain. So if the ammonia got deposited in the brain, what we are going to see in the patient, sir, neural symptoms. The neuro symptoms will be there in the question. Let's see the patients, the liver pathology patients. The patient says the patient was hospitalized with the gradual onset of the disease, and nausea, vomiting, dark urine, acolic stools, yellowing of the skin, And sclera's liver is enlarged by 3 centimeter. Jaundice developed on the 14th day after the disease diminished in size. So first of all, things to remember in the question. So first, the gradual onset is there: nausea, vomiting, dark skin, and yellowing of the skin. So jaundice, we have got jaundice is there because liver pathology, so jaundice will be there. Yellowing of the skin and sclera. Liver is enlarged by 3 centimeters. So first the liver was enlarged, and then on the 14th day the liver diminished in size. So first the liver got enlarged and then liver diminished in size. So enlargement is still okay, but if the liver is getting diminished after getting enlarged, this is a very bad or worse sign. I have written here that a diminished liver is worse than the enlargement of the liver. So, what complication would have occurred in the patient? Sir, hepatic encephalopathy, that the liver got shrink this time. From viral hepatitis, we know that these are the symptoms of viral hepatitis, guys. We have talked in the hepatitis portion: jaundice, vomiting, dark urine, acolic stool, yellowing of the skin, jaundice, gradual onset. This is viral hepatitis. We have talked about it in a different video. What complication would have occurred in the patient? Sir, the complication occurred in the patient is hepatic encephalopathy due to loss of the function of the liver, which is liver's detoxification of ammonia. So the liver cannot detoxify anymore, and now what happened is, now the ammonias got deposited in the brain of the patient, and this is the case of hepatic encephalopathy. Next patient is hydatid disease of liver. We all know that hydatid is also known as echinococcal disease of the liver, which is I have discussed in the videos or shorts portion of it. I have shown you the x-ray over there, x-ray or MRI or whatever, a USG, ultrasonographic investigation. I have shown you in the short version. You can see a photo. Let's hear it from patient. Sir, the patient says he is a hunter first of all. So zoonotic infection, the hunter is already prone to the zoonotic infection. Heaviness in the right subcostal area, no other complaint. Causeless urticaria, which is hives or itchy skin. Skin itching occurred 1 day ago. Liver margin is round, painless, can be palpated 3 centimeter below. So liver is enlarged. Temperature is normal. Hemispherical protrusion in the right capita of the diagram. So sir, what will make sense in this question? Sir, first of all, he is a hunter. He is prone to the echinococcus disease or hydatid disease of liver. They both are the same things. Next thing to remember in the question is, sir, urticaria. Sir, allergy cannot be caused by other things like urticaria is some sort of hives, we call them, like the allergic reaction or allergic edematous reaction, which you will see in yourself as well sometimes, but not always the echinococcal case is there. That's just allergy in your case. Acute causeless urticaria, sir, when the echinococcal infection is there, it will cause allergy, and unlike hepatitis is not gonna cause any allergy to you. Skin itching is there. Next thing to remember is liver is enlarged. This will be in all the liver pathology. Hemispherical protrusion. Sir, what are these hemispherical protrusion? Sir, you can see the ultrasonographic investigations. So what these echinococcus do is, it will make some cyst in order to divide more. It will make some cyst, or we call them alveoli, in the liver. So they will be a hemispherical protrusion, like a lot of hemispheres will be there in the liver. You can see the USG in my shorts version. Right hemispherical protrusion and right capula of the diaphragm. So yeah, this is enough for this question. Cyst rupture will, if the cyst got ruptured, it will cause anaphylaxis. So we see anaphylaxis in the patient, causeless urticaria and all of this stuff. Next patient says what? 51-year-old man vomiting with blood and drinking alcohol excessively. So liver pathology can be suspect. Yeah. Health disorder observed since he was 40. When he first developed jaundice, on examination, icteric skin and sclera, distension, umbilical hernia, ascites. This is what we want to hear. So sir, if when the case is related to hepatic cirrhosis, so he had first of all, when he was 40 year old, he got his liver enlarged, or a bit of cirrhosis, or whatever you understand. So he already got this in the age of 40. So now what will occur, sir? Sir, when ascites is there, so abdominal distension and abdominal hernia, so this is complication of the liver system. So when liver fails to perform its function, next what we are going to see, cirrhosis in the, so after cirrhosis the liver is not able to perform its function anymore, so we are going to see some GI complications in the patient. So when the hepatic cirrhosis has occurred already, what we are going to see in the patient, sir? Ascites. So always remember that whenever ascites is present with the liver problems, so just mark hepatic cirrhosis and move on, because this is already complicated. However, let's see what else can be there. So liver edges, this and this, painless. Spleen is also enlarged. Spleen is enlarged because it's the result of increased pressure in portal venous system. And cause of portal hypertension in the patient, the question was asking. So sir, what is the cause? The cause of portal hypertension is hepatic cirrhosis. This is why we are seeing ascites in the patient. All right. Next patient says about woman going treatment with the viral hepatitis B. So she is having some history or anamnesis for the liver pathology, and developed nausea, headache, recurrent vomiting, memory relapse. Sir, memory system, first we suspected liver pathology, and now the memory lapses, tremor of hands, which is also a neuro symptom. Sweet smell from her mouth is detected. So you told that sweet smell when get detected from the mouth of the patient, then mark diabetic ketoacidosis. But no, my dear, you have to remember it that in the cases of diabetic ketoacidosis, a different profile of the question will be given. The profile will be like, the patient is diabetic, or something will be given in the question related to diabetes, right? So this time, why the smell of acetone or sweet smell is detected from the patient? Sir, the toxins which the liver is detoxifying from our body are volatile in nature. So when the patient will present to you from the physical findings or from the sensory findings, you can smell the patient, the sweet smell or acetone smell. You can suspect DKA, plus you can suspect the hepatic encephalopathy, or let's say liver failure at the same time. So let's get back to our case. Sir, sweet smell is from her mouth is detected. She or he have temperature, heart rate is high, complication developed in patient. Sir, this is the liver failure this time, because the complication. So first, viral hepatitis, we suspected something with the liver. Next, the symptoms has moved to the neuro system, because we see memory thing and tremor of hand. These are the problem with the neural system. Yeah. So the liver got failed first of all. So this is the case of acute liver failure. So after the liver failure, the ammonia got deposit in the brain, which is causing hepatic encephalitis. So this is the case of acute liver failure with the neuro symptoms or hepatic encephalitis. So the option which you have to mark is just liver failure. No need to worry about, because encephalitis will not be given in this question. So next patient is saying that he ate some unknown mushrooms. Sir, which mushrooms are typical for liver patients? Sir, Amantia species is typical for the patients of liver failure. Amanthia species, if the patient is ingesting, so that will be difficult. And which result in a 28-year-old man sensory decreased mobility and deterioration of the focus ability, followed by agitation, aggression. He is deteriorated and his speech is illegible. 4 hours later he developed factor hepaticus, which is sweet musty odor or accumulation of volatile organic compounds. So you know that this is the similar smell as given in the last question as well. So the patient is the case of acute hepatic failure, again with the hepatic encephalitis, because first the liver got failed and later we see the agitation, aggression in the patient, which are related to the neural symptoms. Factor hepaticus is the hallmark finding for the hepatic failure, sir, because when the liver cannot detoxify the toxins anymore, the toxics are volatile in nature. They will start to evaporate or they will start to produce smell with the speech of the patient. Next is pleural effusion. So what is pleural effusion? Sir, effusion is accumulation of excess fluid in the pleural space, which will lead to some congestion over their lung cavity or chest cavity, whatever you like to say. So effusion is simply the accumulation of excess fluid buildup in the pleural space. Symptoms we are going to see will be respiratory symptoms, shortness of breath, chest pain, especially during breathing, because when the person is doing inspiration, so fluid are there, so already a congestion is there. When the person try to inhale, so the fluid causes congestion and pain. Decreased breath sounds on the affected sound because fluid will be there. Fever and chills, because this would have been caused by some infection for sure. And shortness of breath and all of these symptoms will be there. So let's see what is transudate and exudate. So this is something which you have to remember for the questions. So transudate and exudate. Sir, there are two types of pleural effusion. Transudate will occur due to the systemic factors that alter the balance of fluid production of absorption. So what are the things you have to remember is in this one that the main symptoms of transudate infection will be congestive heart failure, like the organ failure will be there, liver failure, nephrotic syndrome in the kidney, which is glomerulonephritis, and low albumin level will be there, sir. Sir, in the cases of exudate infusion, we will see infection, malignizations, inflammatory diseases, pulmonary embolism. So other things other than organ failure will be in the exudative category, which is local factors that increase the permeability of the pleural space. Sir, there are two. This is the chest cavity. There is a visceral pleura and parietal pleura. So this is the excess fluid buildup in the pleural space. All right. Sir, just make it clear between transu and exu. We always get confused that when will be organ failure, in which case will be the inflammation, and also remember with the small short technique that transudate in the left portion of my photo, you can see transudate infusion. So it will be related to the systemic issues like the organ issues, heart issues, liver issues, kidney or low albumin issues. All right. And exudate, however, is the result of infection or malignization, which is highlighted here. Sir, what are the contents related to the fluid? So when the fluid we are seeing some fluid buildup, so on the basis of fluid characteristics we can differentiate between transu and exu. Sir, proteins, if less than 3 gram per liter in transu, more than 3.3 gram per deciliter in exu, specific gravity low in transu and high in, so everything will be low in transu and everything will be high in exudate. What are the things which we are going to see low in the transu? That are proteins, specific gravity, the cell count. In high in exudate effusion and low in the transudate. However, the appearance in transudate effusion for the color is, it can be clear or straw colored. However, the exudative effusion is the turbid and cloudy as well. Here is the site for your screenshot. You can take a screenshot and remember from my notes itself. However, only one question in croc exam for the transudate and exudate effusion. First, let's see what is Rivalta test. So Rivalta test is something which is you are using it to differentiate between transu and exu. So based on the fluid turbidity, as we know that fluid will be there, we see that it will be cloudy or straw colored or blah blah. So on the basis of fluid turbidity, we are going to see some changes in the patient. So if the positive Rivalta test is there, this highlights a infection or malignancy. Sir, if the positive Rivalta test is there, so this is the case of infection and malignancy. This will be the case of exudative. And if the Rivalta test is negative, so it will be the case of transudate infusion related to the organ failure. All right. However, here is a question for you. So, a 46-year-old patient went for pleurocentesis, puncture yield 1000 ml of a liquid which is having characters specific gravity. As you can see, it is less than 1.020 or 1020. I remember it as 1020. So it's lesser than 1020, which is low. Protein content is just 1%, which is low in nature. Protein is low. Yeah, lesser than 3 gram per liter will be lower. And Rivalta test is negative. Sir, this is the hallmark finding that when the Rivalta test is negative, this is the case of transudate effusion. And we remember from the table portion of our topic that in the transudate effusion will be caused by what failure? The organ failures. So the option was given inflammation, malignization, blah blah, or heart failure. So sir, only heart failure makes sense here, because we know that when the Rivalta test is negative, it means there is no infection or no malignancy is there. The case is related to organ failure. And the organ failure we will see in the cases of transudate effusion. So the only option which was making sense is cardiac failure. I hope you have got my point. Next is hematology. So I don't want to overflow the video with a lot of values. I have collected the values which you require for your croc exam, or which a med students must know, right? So let's talk about them one by one. So a very short explanation over it. You can take screenshot along with. However, I can post these notes in the post section of YouTube. So hemoglobin, they say hemoglobin. So in the males, sir, hemoglobin is 130 to 160 gram per liter. In females, the hemoglobin is 120 to 150 gram per liter. So similar values. Remember that in all the cases, the hemoglobin of the patient should not come less than 100 at all. That will be the indication for surgery itself, that the hemoglobin should be more than 120 or more than 100 for sure. This is to remember for the question. However, you can see the normal ranges. Next is biochemistry. In the biochemistry, we are using glucose. Sir, 3.9 to 5.8 millimole per liter are the normal ranges of glucose. And after this will be pre-diabetic and diabetic state. Total cholesterol, because we discussed a question that you remember the question when I was talking about the patient management in exam. So there was a question that any dietary changes are necessary, which means that no dietary changes are necessary. So what was the finding over there? Over there you can check in the video, but here let's see about the total cholesterol should be less than 5.2 millimole per liter. LDL should be less than 3. HDL should be more than 1 in male and more than 1.2 in female. So the main thing to remember from this biochemical values is glucose, which is 3.9 to 5.8 millimole per liter. Total cholesterol should be more than 5.2, or for remembrance you can see more than 5 will be the total cholesterol. This is what you have to remember, the main for the questions. If you cannot remember all of them, just remember the hemoglobin, glucose and cholesterol, total cholesterol. Creatine, sir, creatine, how much is the creatine? Sir, creatine is creatine is 62 to 115 micromole per liter in male. In female it is 53 to 97 micromole per liter. So this is you have to remember. However, most of the time when creatine is given in the question, it will be elevated only. Yeah. Next is AST, ALT. Both are less than 40, guys. No need to worry about it anymore. Both are less than 40. So any numbers more than this will be problem with liver. ALP is 30 to 120. Remember only about the AST and ALT. Okay, this is, if you cannot remember all, just remember about the AST and ALT. Albumin. Proteins first. So total proteins or serum protein are 60 to 80 gram per liter. Albumin, do not remember according to me right now. It will be good for you if you do not remember them, because the croc question which says about the nephrotic syndrome, which I have covered in the UTI and glomerulonephritis nephrotic portion, the question says that albumin level are 27, and still that was the case of proteinuria, or let's say nephrotic syndrome. So better not to remember them before croc. You can remember these levels after croc. So just remember from here that AST, ALT and proteins, and main thing to remember is, sir, the question will give albumin level 27 gram per liter to you. Sir, according to croc question, these levels are high and you have to mark the nephrotic syndrome for that question. Remember guys, please, albumin level 27 is high for croc examiner for nephrotic syndrome. Let's go next is electrolytes, which you have to remember. We have already talked about them in some corners. 135 to 145 millimole per liter. Potassium is 3.5 to 5.1 millimole per liter. However, the ranges are fluctuable, so get ready for this, that a little bit elevation or derivation you can see in the examiner's opinion. So calcium level, from the electrolyte portion, most important for me, for you to remember is sodium and potassium. It will be most important for you and me to remember about potassium and sodium for sure. However, calcium levels are around 2.1 to 2.6. It's not very important under the sodium and potassium. It's not very important, but some students want to score more than 95. So let's hear it. Calcium's total calcium is around 2.1 to 2.6. Magnesium is 0.7 to 1. So sir, a sharp idea which we can make here, or let's say some idea, that calcium and magnesium levels are magnesium is around 1 and calcium is around 2. So not very difficult, right? Calcium are around 2 and magnesium are around 1. If you cannot remember the direct datas, at least you can remember that calcium is around 2 and magnesium is around 1. Yeah. So chlorine is 96 to 106 millimole per liter. Bicarbonates or HCO3 negative are 22 to 28 millimole per liter. pH should be 7.35 to 7.45. PCO2 should be 35 to 45 mmHg. Partial pressure of O2 should be 80 to 100 mmHg. So I hope this makes sense now. You can see in the cases of metabolic acidosis and all of those stuff about these values, but important for me that you remember at least sodium and potassium for sure, and remember that calcium is around 2, magnesium is around 1. However, only one question was there related to the calcium values, which was solved without knowing the calcium values as well. Next is hormones. In Ukraine they say hormones. So TSH should be 0.4 to 4.2, T3 should be 3.1 to 6.8, and T4 should be 12 to 22. They are units. The units are picomole per liter. For the TSH, the units is micro international unit per liter. So cortisol in morning should be 138 to 690 millimole per liter. Insulin fasting insulin should be 2.6 to 2.4 micromole per liter. So sir, if you can remember the hormones, it's good. If you cannot remember, it's fine. Not really very typical for croc questions, but good if you remember. Yeah. Let's stay one step ahead of the examiner. So next is bilirubin. So bilirubin in the units milligram per deciliter. Total bilirubin is 0.1 to 1.2. Direct is 0 to 0.3. Indirect is 0.2 to 0.8. Let's see another units which the examiner will give you and confuse you well. So next unit of bilirubin is a micromole per liter, m mole per liter, or mc mole per liter. Anything can be given to you in the question. So however, most of the time when bilirubin's levels are given in the question, they want to highlight that they are elevated itself. Yeah, but let's make some sense with the values now. Direct should be 0.0 to 5.1. Indirect should be 0.2 to 0.8 micromole per liter. So as you can see in both of the value, however, you may remember from some question that the question will be saying about the level of bilirubins are exceeding like 60, 102, 200, or blah blah maximum values. But you can make some sense here that in any case or in any kind of the units, the value of bilirubin or any kind of direct or indirect, the value is not exceeding 20, right? Everything in the portion bilirubin is below 20. So after 20, when you see any word in the exam, so that will be elevated, sir. I hope it will make sense now, and I have told you what are the things you have to remember from this portion. Next is normal ranges of WBC. We have also discussed it in the acute and chronic leukemia portion. However, let's look at never let monkey eat banana once again. So this was our mnemonic for the remembering the WBC. Never let monkey eat banana. So neutrophils are 40 to 70, elevated in bacterial infections. Lymphocytes are 20 to 40, elevated in viral infections. Monocytes are 2 to 8, elevated in chronic inflammation. Eosinophils are 1 to 4, elevated in allergic reaction or parasitic infection. Basophils, we remember from basophil portion very well that in the acute and chronic leukemia, we discussed about this finding that if the basophils are more than 1%, it will be allergic reaction, or it will be for sure chronic leukemia myeloid version. So I hope you will remember these values. Most important, however, all of them are important. We must know about the WBC ranges. In the question about meningitis, they will give neutrophils to you, so you are sure that it's a bacterial infection. In the question about chronic myeloid leukemia, they will give you the basophils. So basophils when elevated, this is the hallmark for CML. So a lot of things. Eosinophils when elevated, you are sure about the asthmatic reaction or allergic reaction. Yeah, so I hope you'll remember them. However, in the corner, segmented and band are also given. So remember guys, segmented neutrophils are 50 to 70%, which are mature ones, and bands are 0.5%, which are immature version of neutrophils. So this is it with this video. If there is something, let me know in the comments, and have a nice day.